Hello viewer, welcome to Health Now Show with me, Jane Kariuki. I am a counseling psychologist and I'm so glad to be here today to share with you some very important issues and concepts and tips about our health. We talk about Health Now Show as a show that is your friend in health because we come and share information, we come and share tips, we come and share areas that affects you on a day-to-day life concerning your health, emotionally and physically. And today is not different because we are having a great show. Our guest today is somebody that has been on the show before and talked about uterus. It's a doctor that talks about the uterus issues. And my viewer, I know we have received a lot of feedback, a lot of areas that you'd still need the doctor to address. And that is the reason why we are with her today. And what is the topic today? The topic today is pregnancy and birth or delivery. Today we are going to have two parts. One, we are going to start with pregnancy. All matters, all issues that relates to a pregnancy. Then in our part 2, we'll do delivery. What are some of the issues that we need to know? What are some of the issues that probably have given you trouble before when you're delivering your babies? And for those that have not had babies, what can they do? How can they prepare? And that is what we are going to do today. And without taking much time, I want to welcome Dr. Mary Maina. She's going to introduce herself for the benefit of those that have not been with us before, those that are in many parts of this country and all over the world. And from there, we are going to get deep and start moving on this very important topic to us. Karibu Daktari.
Thank you very much, Jane. I'm excited to be back.
Yes.
Thank you for having me.
Yeah.
So my name is Dr. Mary Maina. I am a consultant gynecologist at Kiambu Specialist Doctors Plaza, which is in Kiambu town. And I'm happy to talk to us today on the topic that Jane has introduced. And you're most welcome. Thank you.
Asante sana. Karibu tena. Today, as I said, we are going to look at the first part. We're going to look at pregnancy. Daktari, if I want to become pregnant, of course not me, I've already been pregnant before, twice.
Yes.
If I want to become pregnant, what are some of the things that I need to consider?
Okay, thank you for that very important question.
Yes.
Because that's one area that has been neglected. We call it preconception care.
Ah.
So preconception care is one of the areas that are neglected, and unfortunately our women do not come to us before they get pregnant. Most of the time they come when they are pregnant.
Okay.
And what that means is that if there is something that needed to be corrected before you got pregnant, then we miss out on that chance. So what do you need to do? So preconception care, we advise women to see us about 90 days before you get pregnant so that we can prepare your body for the pregnancy. So there's some people who we would call high risk, who ideally should come before they get pregnant. Anyone who is on chronic medication, let's say I have epilepsy and I take medication every day.
Yeah.
You should see your doctor so that the doctor tells you, do we need to change this medication? Is this medication safe in pregnancy? Do we need to adjust the doses of your medication so that it doesn't have an effect on your pregnancy? So anyone who has a chronic illness, epilepsy, diabetes, hypertension, or any other chronic illness that you could be living with should see the doctor before so that we can have a discussion. The other group of people is people above 40 years and people below 20 years. Because we know that those two groups tend to get complications more than the group in between them. Okay, so we call them extremes of reproductive age. So if you're above 40, you're planning to get pregnant, we really advise you that you should see the doctor before. If you're below 20 and you're planning to get pregnant, you should also see the doctor, because there are some diseases that are more common. There are some complications of pregnancy that are more common in those two age groups. Yeah.
You said how many days should I see the doctor?
90 days.
90 days.
Yes.
Those are about 3 months.
Yes, those are 3 months.
Yeah.
So we should be able to prepare your body for about 90 days before you get pregnant. That is the recommended. But if you're able to come even before, the better, so that you can have that discussion.
Yes.
But the minimum really should be about 90 days so that we can prepare your body.
Yes.
So we also advise our women who have had a child who had one form of an abnormality or another. Okay, so maybe I gave birth to a baby with especially what we call neurotube defects. Neurotube defects are disorders of the brain and the spinal cord, which are known to be caused most of the times by a deficiency in folic acid, and they are quite common. So we should be able to put you on folic acid for those 90 days to prevent that from happening again. The other group is women who keep losing pregnancies. You know, sometimes you come to the doctor and think the doctor is being harsh. The doctor is not being harsh. It's because you have probably lost 4 pregnancies, and the next encounter is when you're pregnant.
Oh.
When ideally you should come before you get pregnant,
Yes.
so that we identify, is there something we need to fix before you get pregnant,
Yeah.
so that you don't end up losing this pregnancy as well.
Yes.
So ideally every woman should see the doctor before they get pregnant, but there are those high-risk groups that we advise that before you conceive, let us have a discussion, so that if we need to treat something, if we need to discuss on how to take care of you when you're pregnant, we do it before you actually get pregnant. Yeah, so I'm advising everybody before you get pregnant, please see your gynecologist and have a discussion with them.
Yes.
Yes.
And I think that is very important, Daktari, because in my mind, I would not have thought about that.
Yes.
But
yes.
I think this is very, very important. And that's why I keep saying that our show, it's about sensitizing and giving, sharing information. Tunaweza kuendelea.
Okay.
Yes.
Yeah, so when you come to us, we will have a discussion and have a look at when do you lose your pregnancies. Because loss of pregnancy, for women who keep losing pregnancies, loss of a pregnancy, the causes are dependent on the age at which you lose them. So if you come and tell me I lose my pregnancies in first trimester, I'll tell you, let us do these tests before you get pregnant. Then if I lose my pregnancies in second trimester, I'll probably tell you that at this time of your pregnancy, we might need to do something. Okay, we may not need to do a test if you lose your pregnancies in the third trimester. So we'll basically be looking at those things way before you actually get pregnant. And then once you get pregnant, we will tell you there are some medications that we probably will put you on. They're the routine ones that we give to every pregnant woman. But then depending on the risks of an individual, we may need to adjust and probably put them on something more. Yeah, so there are tests that we may need to do for some people before they get pregnant based on their history. Yeah, so we basically individualize your care because my problem may not be your problem.
True.
So we individualize, and we can only know that from taking a history. Then there are some people whose families have maybe particular illnesses. You may not have it, but in your family, you have a sister, a mother, a brother who is diabetic, okay? And we know that some of these things tend to run in families. Much as myself, as a patient, I may not be diabetic, it would be advisable that I am screened because we know that the risks are very high. And we know that there are some diseases that show up in pregnancy, okay? I may not have it, but then it shows up in pregnancy. For example, what we call gestational diabetes. I may not be diabetic, but because I have a very strong family history, then during my pregnancy, something shows up. And now those are the discussions that we should ideally have way before you actually conceive. So we encourage every woman planning to get pregnant, please come, let us have a discussion so that by the time you're getting pregnant, you're armed with this information and we have checked and ruled out any diseases that may be causing you trouble with your pregnancies, any diseases that might crop up during your pregnancy, then we have a discussion, because we always say the doctor has their part to play, the patient has their part to play, and then you leave the rest to God.
True.
Yes.
I've heard some people say that they go back to their family history if they have experienced a condition, like now what you're talking about, diabetes, and then they say, kwetu hakuja kuwa na mtu with diabetes, and why am I having it now? But you've explained very well that it could be triggered by this, by the pregnancy.
Yes, absolutely.
Tuendelee, daktari.
Okay.
Yeah.
Yeah, so during the preconception period, we will routinely almost put every woman on folic acid.
Okay.
Because folic acid is actually one of the most important micronutrients in pregnancy, especially during pregnancy, the first 3 months, and the preconception period. So most of the women, when they come to us before getting pregnant, you will find almost every woman on folic acid.
Yeah.
Because the good thing about folic acid is it prevents a lot of problems that are related to pregnancy. Yeah. So like what I've said, the disorders of what we call neurotube disorders, it prevents most of those things from happening, early pregnancy losses. Yeah. So we find almost every woman who come to us before conception will actually be on folic acid, and we tell them continue during the first 3 months, and then after 3 months we will add other things that we'll talk about later on in the show. Yeah, so we encourage every woman, even if you don't manage to come to us and you're planning to get pregnant, please buy folic acid and start taking it. You can get it over the counter, doesn't require a prescription. It is a drug that you can easily buy by yourself. Take it for 90 days, then get pregnant and continue taking it. Do not stop. Then for the other patients that I said, sometimes you have a high-risk patient. There are others you'll find us putting them on things like aspirin.
Okay.
But now these are specific for specific conditions. So if you find that maybe someone keeps losing pregnancies at a certain age, or they get high blood pressure in pregnancy, you'll find us starting them on junior aspirin at a certain point in the pregnancy. And those are now the discussions that usually take place during the preconception period.
Okay.
Yes.
Yeah. Another one, probably.
So maybe the other thing would be, depending on the particular individual we are talking about and the reason why they have come to us, there are people we will even put on some drugs that are injectable. Okay? So someone comes and tells you, every time I get pregnant, I get a clot. I get a blood clot. Because we know that pregnancy is one of the big risk factors for clot formation.
Okay.
So for those people, if you've had a clot in any of your pregnancies, if you've been pregnant before, we will put you on an injection of a drug called heparin. Okay.
All
So
right.
as soon as you get pregnant, because we know that if it has happened before, it's going to happen again. And usually the second time is worse. Okay. So we give what we call prophylaxis. Prophylaxis means we are giving you medication to prevent a condition that we know is most likely going to happen. So anyone who has had a clot formation in pregnancy will always be put on a drug that they inject themselves throughout the pregnancy and up to about 6 weeks after delivery, because we know that those are the high-risk times. And if that clot dislodges, if you form the clot and it goes to the lung, that's what most people will call a heart attack. Very common in pregnancy. And that's why we are insisting that come, we have a discussion, because my disease may not be your disease, and I can only get to know what needs to be done for you by having a chat with you and preparing you and your body for the pregnancy. So I think for preconception, that really would be it before you get pregnant. Then once you get pregnant, then we have a journey. A whole journey ahead. Then you can have, if you've had those discussions preconception, then even the pregnancy becomes a lot easier.
I'm looking at you and I'm thinking like, what have we been doing? What have we been doing, some of us?
That's why we are here.
My goodness, my goodness. Yes. It's more of an individual kind of kind of tailor-made to my body,
Absolutely.
to my health,
Yes.
to my condition,
Yes.
if I have a condition.
Yes.
And this is really, really nice.
Yes.
Thank you.
Yes.
Tuendelee now.
Okay.
Yeah.
So now once you get pregnant, we have a discussion about what do you expect? What are we going to do?
Yeah.
And what is expected of you?
Yes.
Okay?
Yeah.
Because remember, it's not your doctor who is pregnant. You're the one who's pregnant. So the expectations on your part are actually more.
Yeah.
So once you get pregnant, then there are things we call the danger signs.
Yes.
Okay?
Yeah.
So we will have a discussion with you and tell you there are things you need to look out for. Okay? Because that's where we go wrong most of the times, because we come in late. You know, someone shows up and tells you, I started bleeding 3 days ago. And in my head, my question is, where have you been for 3 days?
Oh, 3 days.
Okay? Yes, so the danger signs, we usually would divide them in based on the trimester, because the complications of every trimester usually will be different. Okay?
Yeah.
So a pregnancy is divided into 3 trimesters of 13 weeks each.
Okay.
So the first trimester will end at 13 weeks, the second trimester will end at 27 weeks, and the third trimester ends at 40 weeks. So we say pregnancy is divided into 3 trimesters of 13 weeks each.
Yes.
Okay?
Yeah.
So the first trimester ends at 13 weeks, a very critical period. We call it a critical period because that is when a baby forms. Okay?
Yeah.
The other trimesters, usually the baby is maturing. But the baby forms in the first trimester, and we usually say that anything that goes wrong in the first trimester will most likely remain wrong. Okay? So if I was on a drug that I should not have taken in the first trimester and I took it, if it caused any harm to my baby, that damage is likely to remain with the baby for life.
Until the baby probably is born?
Even after the baby is born, most likely,
Yeah.
if it is something that should not have been used and it causes harm to the baby, it probably will be a lifelong injury to that baby. So that is why we encourage you, if you're on any medication, if you didn't do preconception care, immediately you realize that you're pregnant, you should run to the doctor so that they give you a way forward with that particular drug. Because there are some people who've been on treatment for something, they did not know that they were pregnant. So we say immediately you realize you're pregnant, then you come. So what are the expectations in the first trimester? So for every pregnant woman, there are tests that we do.
Okay.
We call it an antenatal profile. And this is something done whether you're in Kenya or you're in America or you're in the UK.
Yeah.
Those are standard tests.
Okay.
And why do we do these tests? These tests are done because if there's a problem, that problem could be transmitted to the baby. So we need to do the test so that we can correct or make interventions that prevent the mother, if they have this problem, from transmitting it to their baby. Okay? And that is why we do it at the earliest opportunity. Our first contact with a mom, we will do those tests, and those tests include a HIV test, yeah? Because we know that if a mother is HIV positive, without any intervention, they could transmit the virus to their baby. However, with intervention, we know it's 100% preventable.
True.
Okay?
Yes.
Then the other important test is the blood group. Why do we do the blood group? The blood group is important because if you have a mother whose blood group is negative, there are only 2 types, positive and negative.
Yeah.
Majority of the world, about 85%, is blood group positive. But if a mother is blood group negative, then a problem could arise if there are no interventions. And this problem is that if the mother is carrying a positive baby, because remember, a baby has a chance of either picking the mother's blood group or the father's blood group. So if the father is blood group positive and the baby turns out to be blood group positive, and we know that during pregnancy and delivery there is a bit of mixing of the mother's blood and the baby's blood, if the mother who is negative receives blood cells that are positive from the baby, this could bring problems in future for any baby she carries who is positive. So there are interventions that we make. They get an injection of something called an anti-D at 7 months, and then they get it again after delivery if the baby turns out to be blood group positive. So the other important test in the antenatal profile is the syphilis test. So we test for syphilis because we know if the mother has syphilis, if it's not treated, they could transmit it to the baby. And if we find it positive, the mother gets an injection that treats her of the syphilis and therefore cannot transmit it to the baby. So the other test is the blood sugar test, because we know one of the commonest complications that can arise in the process of pregnancy and birth is what we call gestational diabetes. Gestational diabetes is diabetes that shows up for the first time in your life when you're pregnant. Mm-hmm. Then the other test is we test for your level of blood, what we call HB. This we do because we know that during pregnancy and delivery, the demand for iron is very high, okay? And some mothers come when their HB is already on the lower side. So we need to know whether we are treating you for anemia or we are just giving you supplements for iron to prevent your HB from going low. Then, of course, we test you. We do a urine test. Urine is very important in pregnancy. Okay. And most people, when they come to the clinic, they get annoyed because we do a urine test every time. We are not looking for an infection only. Okay. The urine can tell us a lot about what's going on. For example, one of the things that happens when someone has high blood pressure, there's high blood pressure that happens in pregnancy, mm-hmm. called preeclampsia, which we will talk about. Mm-hmm. It's one of the commonest complications of pregnancy and the second leading cause of death in pregnancy and delivery, mm-hmm. in mm-hmm. our setup. Mm-hmm. It's actually the second commonest cause of death of pregnant women or women during childbirth. Yeah. So one of the things that happen is that they start leaking protein in urine. And that's why you'll find that most hospitals, when you go to the clinic, even when you don't have symptoms of a urine infection, we'll ask you to do a urine test because we are looking for protein. And also for diabetes, you can actually sometimes diagnose it based on the urine, because if you find glucose in urine, we ask ourselves, why is this mother leaking glucose in urine? Is it that the sugar is very high, therefore it's leaking? So the urine tells us a lot. So that's basically the package. And then the last test is usually hepatitis. Mm-hmm. Hepatitis is also a disease that if the mother has, she can transmit it to the baby. So we test for it. Much as it doesn't have a cure, we may not cure the mother, but the interventions we will make when the baby is born to prevent the baby from getting hepatitis. Mm-hmm. So that is basically the package that you hear saying you need to do an antenatal profile. Mm-hmm. Those are the tests done routinely for every pregnant woman. Mm-hmm. And then, of course, there would be other tests based on your individual history. Yeah. Okay? Mm-hmm. Yeah. So, but those ones are standard for every pregnant woman. Mm-hmm. We are encouraged that you do it at the first encounter. Mm-hmm. And then the other thing we encourage you to do at the first encounter mm-hmm. is usually an ultrasound, a first trimester scan. Yes. Why is a first trimester scan important? Mm-hmm. Because number one, mm-hmm. it's going to tell us mm-hmm. where is your pregnancy. Yes. The only way we can know where the pregnancy is mm-hmm. is by doing a scan. Yes. And by where is the pregnancy, I mean, yes. pregnancy should ideally be inside the uterus. Mm-hmm. What you call an intrauterine pregnancy. And the other time you told us the uterus. Yes. Yeah, yeah. Yes. I've got it right. Yes, you did. It is the size of your face. Yes. Yes. Yeah. So we can have pregnancies that are outside the uterus mm-hmm. that are called ectopic. Mm-hmm. That could be life-threatening if not picked early. And the only way to know where the pregnancy is to do a scan. Mm-hmm. The other reason a first trimester scan is important mm-hmm. is to tell us how many babies are inside there. Yeah. Could be one, yeah. could be two, could be three, could be five. Yes. Yeah, so the only way to know is by doing a first trimester scan. Mm-hmm. Then the other reason why a first trimester scan is important mm-hmm. is to tell us whether the pregnancy is actually growing. Uh-huh. Because sometimes you find someone who thinks they are 7 months pregnant, mm-hmm. but the pregnancy stopped growing when it was 6 weeks. And they didn't know. Because if I have missed my periods for 5 months, I have done a pregnancy test, it is positive, I think I am pregnant. And yes, right, I am pregnant, but is my pregnancy growing? Because there are things that could go wrong, and you get what we call a missed miscarriage. A missed miscarriage meaning your pregnancy stopped growing a long time ago, or what we call a blighted ovum. A blighted ovum is when the pregnancy forms everything else except a baby. Okay, so you're there sitting, planning how to have this baby, and yet
probably
you're not
even
pregnant.
buying all the things that you
Yes.
need as you prepare for the baby.
Yes, yes, and that's why we insist on a first trimester scan. A first trimester scan is also important because it tells us the dates of your pregnancy. Because as you realize, sometimes someone is not sure, when did I get pregnant, you know?
Yeah.
So they're not sure when they got pregnant, and when they come much later, you're not sure when to tell them that this is when your baby is expected. So first trimester scan is also usually very accurate in dating a pregnancy. So if it tells you you're 6 weeks, you're most likely 6 weeks, as opposed to the other scans in second and third trimester, usually there will be a difference, sometimes of up to 2 weeks as the pregnancy grows. Yeah, so that's why a first trimester scan is very important.
I've had people say that Daktari want me to do a scan just for that, for the sake of it. Others say, I've not done a scan, so I don't know the sex of my baby, the gender of my baby. So probably that is what most people go for a scan, for the ultrasound, but not what you have talked about.
Actually, in fact, for the gender, it's never written anywhere, if you notice. When you're given your report of the scan,
Yes.
the gender is never written anywhere. Because we never really do a scan for the gender. The gender is for the parent to know, and they have that discussion with the person doing the scan.
Yes.
They never write it anywhere because that is their own discussion.
Yes.
For us, there are things we usually will be looking out for. Like I've said, first trimester scan, those are the things we want to look out for.
Yes, very important.
Yeah,
very,
true.
very, very critical.
Yes. Then the next scan that usually we will do, this is in a pregnancy that's not having any problems. We do the next scan at 20 weeks. And the scan at 20 weeks, we call it anomaly scan. Anomaly scans are usually done from head to toe. By this time at 20 weeks, the baby has fully formed. You can actually see all the organs of the baby. So we do an anomaly scan routinely to just make sure that the baby is fine from head to toe. Then the last scan we usually will do at around 37 weeks, just to know whether your baby has turned, is the placenta in the right position, basically in preparation for labor. And as you're saying, there are people who even come with twins without knowing they had twins because they have never done a scan.
Yes.
So they deliver the first baby and you hear the midwives asking, it looks like there's another baby.
One.
You know, so you had shopped for one baby and then you're in labor ward and people are telling you there are 2 babies here. So that's why it's important to do these ultrasounds, yeah? So those are usually the tests that we will do routinely. We do the blood test in the first trimester, then the 3 scans throughout the pregnancy, 1 in first trimester, 1 at 20 weeks, and 1 at around 37 weeks. And for pregnancy that's not problematic, usually that's all we will do in terms of the test. Yeah, so we don't need to do any other test unless, of course, an issue arises in the course of a pregnancy. If you show up and tell me when I'm passing urine, I'm feeling pain, then I'll probably ask you to do a urine test.
Okay.
Yeah. If you come and tell me, I am passing urine a lot more, I'm drinking a lot more, then I'll probably test your sugar again, okay, to just see, could this be signs of diabetes in pregnancy? Yeah, much as sometimes it doesn't present in the typical way, and that's why we screen for it, whether you have symptoms or not, we screen for diabetes in pregnancy.
Yes.
Ideally should be for every mother,
Yes.
the ones who come to the clinic. So we check for it because we know that there are some women who will show up for the first time with diabetes in pregnancy, as you said, even without any family history. Yeah, but those are basically the routine tests in pregnancy and the routine ultrasounds in pregnancy, the 3 of them.
Okay.
Yes.
So now we are at the 3rd trimester.
I was talking about the tests done. So now to discuss the trimesters. So the first trimester, what do you need to look out for? The most important sign in first trimester is usually bleeding. Okay? And bleeding, I want to say this to women because they come and say, I thought it was normal. There's no normal bleeding in pregnancy. Okay? Not even a spot of blood. Any bleeding in pregnancy should take you to hospital in the next few hours. If it's at night, when you wake up in the morning, the first thing you should do is go to the hospital.
Bleeding.
Any bleeding, be it a spot of blood or be it a lot of blood.
So long as you are pregnant.
So long as you're pregnant,
it should not be there.
There should not even be a drop of blood. Okay? Because it's just a sign that your pregnancy is threatening to come out, or maybe there's even a problem with that pregnancy and the body is giving you a sign.